Доброго дня, дорогі колеги. Раді вас всіх вітати на сьогоднішньому засіданні першого міжнародного медичного форуму, який присвячений 125-річчю з дня утворення Лікарської комісії наукового товариства Шевченка і 150-річчя НТШ. Дозвольте представити нашу роботу, наші думки стосовно проблеми, яка є надзвичайно важливою і ще достатньо мало відомою в Україні і присвячена, власне, міжпрофесійній освіті у навчанні майбутніх спеціалістів охорони здоров'я. Поділитися досвідом Американського університету про здоров'я, що знаходиться в Каліфорнії в Америці, я хочу разом з моїм колегою Давідом Омутом, який є, власне, фахівцем у такому навчанні. З початку повномасштабної війни я була запрошена для роботи в цей університет, з яким ми маємо співпрацю понад 10 років. І саме цей напрям захопив мене, оскільки я розумію, наскільки важливе вміння комунікації. І зараз я представляю слово своєму колезі Девіду для того, щоб він представив себе і свій університет.
Hi, everyone. My name is David Omut, and I'm representing the American University of Health Sciences in Signal Hill, California. So this is a picture of the front of our school. We're located in the city of Signal Hill, which is part of Long Beach City. Long Beach has one of the largest ports in our nation. It handles roughly 60% of all the import and export on the West Coast. So we're part of a very big community here. So what we wanted to talk about is kind of this idea of an ongoing collaboration. As you see in this announcement, there are several organizations that are working together, including the U.S. National Science Foundation, or the NSF, as we like to say. So we're looking forward to more collaboration, and that is what we're doing today, is looking forward to collaborating with you all. All right, this is a picture of the school that you guys are at, right? Let's move on. So what I do at American University of Health Science is something called interprofessional education. I may refer to it as IPE. So interprofessional education is all about having more professions work together. So in our school, we have the School of Nursing, the School of Pharmacy, and the future School of Medicine that work together. Now, the idea of interprofessional education can seem very complex. So this image on the screen may seem complex, but it's simple if you understand. The idea is we all have health needs. So in the hospital, for example, there are healthcare needs. Now, before we can get to the end on the top right over there where it says good health outcomes, we need to have interprofessional education where all the professions learn to work together. So what we like to say here at the school is that healthcare is a team effort. No one profession or one person is in charge of every element of healthcare. So this is why we need nurses, physicians, pharmacists, etc., all working together. This is an image of how our simulation lab looks like, where we perform IPE, or interprofessional education. So you can see that we have a patient there on the bed. The patient is a mannequin in this case, but we have used real people that are actors that portray certain conditions. Those we call standardized patients. So we have an approach that we call the 5R method of how we do interprofessional education. So they are refocus, focusing on role and responsibilities, making sure we all respect each other and each profession, taking time to reflect on what was done in the scenario, for example, part of the debriefing process. And then we're trying to reduce inefficiency and trying to have everyone work together in more synergistic style. The idea of implementing interprofessional education started with this organization you see on the right here, the Interprofessional Education Collaborative. And what they did was, in pharmacy programs, School of Pharmacy, they started to implement other professions working in some of their scenarios. So in 2009, they had nursing, osteopathic medicine, pharmacy, dental education, medical colleges, and public health institutions working together. Now that expanded over time. And you can see how in 2016, we included, this organization included podiatric medicine, physical therapy, occupational therapy. These two are really important, and we'll discuss a little bit about that later on. Now, here at the school, we have this image of how we increase the amount of interprofessional education. So you'll see the PY1, it stands for Program Year 1. You're going to see how that is related more to exposure and immersion. So just exposing them to different healthcare environments, so different kinds of situation. So we try to have scenarios that will expose the pharmacy students and the School of Nursing students to different kind of healthcare situations. Then as we go up and it's getting more and more immersive, we see immersion. Later on, we see experience and competency. So what that says is Program Year 1, we're more focused on exposure and immersion. Program Year 2 is where we have the students actually practicing and gaining experience. And then hopefully by Program Year 3, the students will have gained competency or gained the skills and knowledge needed for success. Now, you'll see how we've kind of developed a few competencies that help us when we talk about these kind of immersion, collaborations and these IPE events. The first competency is, of course, values and ethics for interprofessional practice. So obviously, what's most important is to have that foundation of the ethical framework that we all have an ethical obligation, not only to help the patient, but to work together. Moving on, it's very important that we discuss the roles and responsibilities. In the United States, we have a lot of different professions with very specific roles and responsibilities. Now, I understand internationally that may be different, but for example, respiratory therapists. These are professions that maintain the ventilators. They interact with BiPAP, CPAP, all of those kind of respiratory machines. So they have a very, very unique role and responsibility. So nurses, physicians, pharmacists need to understand what are all these different professions and what do they do and what are they responsible for. Then we have communication. So there was a study saying that about 60% of all medical errors are due to a breakdown in communication. So we understand that communication is one of the most important elements. And then lastly, how do we work as a team and how do we promote teamwork? Moving on, our strategy here is also based on values. So we have a bunch of things going on, competencies, values, but on the left side, you see our IPE core values. And then you kind of have a list here of what we do step by step. So maintain and sustain a culture of interprofessional education. This is actually a really important one. And the reason I mention it is as we develop the program and as we grow as an institution, it is important that we always begin with an idea of interprofessional education. So that means all discussions and meetings, we try to involve people from the other professions. For example, if the School of Nursing is having a meeting, we like to invite some of the people from School of Pharmacy and the future School of Medicine so that they're involved in these discussions so that all areas of discussions and planning are from an interprofessional perspective. Moving on, a lot of these items like developing an integrated IP curriculum, working with faculty members, a lot of these are dictated by certain kinds of accreditations that we have. So our pharmacy program is accredited by ACPE. And so they have certain requirements that require these elements like meetings, working together, integrating IPE, and stuff like that. Moving on, we also at our institution are involved in social outreach programs. And so that does involve providing healthcare such as vaccination clinics. We also do other kind of social good. We help families who are struggling by providing food and things like that. And then lastly, we're trying to advance interprofessional education by having meetings and conferences where we invite other schools, other organizations, and we try to work together. Now, here's a picture of one area of our simulation lab. These are the 3 acute care environments, like I like to say. On the far left, we have a mannequin that is pregnant and gives birth. So I like to refer to that as our OB room. And the middle one is an adult. And so that could be just our regular med surg unit. And then next to it, we have another room where we can have kind of like an ICU or an emergency room type of a situation. The idea is just to have environments that are similar to what you would see in a hospital or in a healthcare environment so that we can practice in there. Now, this is a picture from one of our IPE events. We have the School of Pharmacy, we have School of Nursing, and we have some medical residents in that room, and we're discussing a case, and you can see me there in the back. So the process of an event is very straightforward. There's three components. One is we brief on the patient. So this is where we discuss what's going on. We discuss certain topics. This is also where we do our pre-assessment. We gather data on the students' feelings and also maybe some questions on their competencies. The second step is to actually perform the scenario. So this is where the students are interacting with the patient, whether that patient is a mannequin or whether that's a person who's an actor. They're interacting with the patient. They're working together. The nurses are consulting the pharmacists, are consulting the residents. They're trying to approach this case together. Obviously, each patient scenario has a patient, that patient has a problem, and we're looking for some kind of intervention. So there's always something we expect from the student. And then lastly, once we're done, we debrief. So this is where we discuss what happened, discuss what went well, what didn't go so well, and this is where we do any of our post-assessment and surveys and data gathering. This is another picture from our simulation lab. We have different environments. So this is more of a kind of a medical surgical area where we may have multiple patients in a row, where we have students practice different skills. We may have different stations where they're doing specific things. But the big idea I always tell all of my students is in the simulation lab, I expect you to make mistakes. So it is okay to make mistakes. I rather the students struggle, make mistakes, maybe do something illogical. I rather them doing it in the sim lab where it's safe and not in the hospital with real people. So I always try to encourage my students, look, make mistakes, do what you think is best, and we'll discuss it and we'll be able to, learn together as a class. Now, this is a bigger picture of our simulation lab. On your left is those 3 patient rooms that I showed you earlier. But we kind of have a classroom and a small meeting space also in this environment. And this is where we can discuss our briefing or our debriefing process. And we can even watch the videos or anything that we recorded. So this is actually a debriefing of one of our IPE events. We have our nursing, pharmacy, and medical residents present, and they're discussing the case they just finished. Now, I was in contact with some of our professionals from the schools, from your school, and we were looking at what is being done in Ukraine. This is the specific kind of bleeding control, wound care, traumatic response training that is happening both on campus and in other healthcare facilities. So you can see these pictures. We actually share a lot of the same equipment. So we have some of the same items that are here. These are more of your resuscitation, wound, trauma, wound care, and tourniquet training to stop bleeding. So that's what's going on here. So moving on, we also discussed the idea of the implication of physical therapy and occupational therapy. So at least in the United States, the big difference between those two, physical therapy is trying to get someone back to a more normal state, whereas occupational therapy is once a patient has a condition that is more permanent, is how do we learn to do life and all of the activities of life with this condition. So there's kind of a different approach to both of them. One of them is more long-term than the other. But what we see here is occupational therapy. It's how we're learning to live, in this case with amputation or with whatever trauma occurred here. So that is one of our goals at the university, is in the future to also include this element in our IPE, interprofessional education. I'd love to have our physical therapy partners help us when we're discussing medical surgical cases and things like that. Now, unfortunately, due to the war, we're seeing a lot more need for rehabilitation, occupational therapy, and physical therapy, and that is one of the reasons why we want to implement it better in our IPE. Now, this brings us to one of the projects that the two of us are working on, which is we want to send a high fidelity mannequin to Ukraine, one that is equipped with the bleeding modules. So on the next slide, you'll see that there are these items that you can add onto the mannequin that simulate, trauma, a gunshot, explosion, and this is used by the U.S. military to do trauma training. In fact, I visited the Los Angeles Trauma Training Center for the Navy, for the U.S. Navy, and this is the mannequin that they use there. The wounds are able to bleed, and you can control the amount of bleeding, and so that allows the first responders a chance to practice bleeding control technique. So that is one of the big goals of this mannequin, is for resuscitation, trauma response, and dealing with these kind of situations. Now, this is some of the bigger pictures from our sim lab. Thank you so much for your attention. I always like talking about our simulation program because I'm hoping that together we can all collaborate and learn how to teach and help our students. All right, I'm going to pass it over.
Дякую всім за увагу, і маємо надію, що ми зможемо працювати над проектом імплементації міжпрофесійної освіти в нашому Львівському національному медичному університеті. І це, можливо, буде основою для гранту, на який ми хотіли би податися разом з AHS, щоб імплементувати їхній досвід у необхідні програми, особливо у розвиток реабілітації і медичної комунікації в нашому університеті. Ще раз всіх вітаю з великим святом. Це дійсно свято медичної і наукової еліти України, 150-річчя НТШ, і дякую організаторам за таку чудову можливість провести в такий складний час таку конференцію. Разом всі до перемоги. Вірю, що, власне, лікарська комісія НТШ виконає настанови блаженнішого Любомира Гузара, місія медиків у війни, бути сильними, протистояти і рухатись вперед. Разом до перемоги. Дякую за увагу.